So today I want to welcome Kara Boone from the Office of Leadership and Learning and Kayla Wall Green from the Women and Gender Equity Center, both here at ODU. They're going to be talking with us today about food insecurity on campus and period equity on campus. And then our very own Erica Stratton-Kang will be talking with us about the Monarch Pantry. So she'll let you know about some resources that we have available if you need them or if you know someone who needs them. Okay, go ahead and take the screen, Erica.
Yes, thank you. All right, let's see. How does that look? Can everybody see the presentation? No, very cool. Let's see.
Oh,
Maybe
and
I might have not said start sharing. Let's see. Okay, here we go. Yes, amazing.
And also, I forgot to mention, we'll have questions at the end. So if you have questions, go ahead and save those towards the end of the presentation, or go ahead and throw them in the chat and I will take care of those for you.
All right, so I'm actually going to start out, as Amy said. I am Erica Stratton-Kang. I am the Vice President for the Public Health Student Association, but I also have a role on campus as an employee in the Office of Leadership and Learning, and part of that role has me working with the Monarch Pantry and food insecurity initiatives on campus. So we're just going to give an overview, a little bit of food insecurity for those that aren't familiar. So one definition of food insecurity is not having adequate access to a sufficient quantity of affordable, nutritious food. And I do want to highlight that in addition to having enough food, food insecurity is also focused on the affordability of food as well as the nutritional quality of food. So you might have heard before of food deserts or food swamps. Activists are kind of moving more towards the term of food apartheid, which is actually a term that was coined by Karen Washington, who's a community activist in New York City. The idea of food apartheid is it kind of takes the focus away from those words like desert and swamps that make an area seem, because those are natural terms, it might make it seem like an area is just always going to be that way, versus food apartheid more focuses on the systems that might make an area have low access to food. So you might live in an area that has a plethora of corner stores or convenience stores and fast food restaurants. So you might be close to food, but the quality of those foods might be low. And then in addition, while corner stores and convenience stores might have fresh fruits and vegetables available, they tend to be more expensive than what they cost at a grocery store. So again, though you might have access to food, it's not an affordable source of food. So with food security, we're talking about quantity, affordability, and nutrition of food. So focusing on colleges and food insecurity on campuses, there was a national survey that was done in 2018, and it found that 1 in 3 college students faces food insecurity. So that's pretty significant, and I think a lot of people don't consider college students when they think about food insecurity. People might think that if you can afford to go to school, you can also afford to pay for food. And clearly from the information that was found in the survey, that isn't the case on a national level. In addition, ODU actually conducted a food insecurity survey in the fall of 2019. And we found that 57% reported that they often or sometimes worried whether their food would run out before they got money to buy more. 52% shared that the food that they bought often or sometimes just didn't last. And 45% offered that their meal swipes or Monarch Plus dollars often or sometimes ran out and they weren't able to buy food. So both of these surveys were conducted before the COVID-19 pandemic, and you can imagine that it's likely that these numbers have worsened due to the effects of the pandemic. So now that we've defined food insecurity, I just want to give an overview of what it might look like, because I think, you know, some people might not have an idea kind of what that might look like on the day-to-day basis. You're not necessarily, you know, don't have food all the time, but it might look like that you're worrying that you might not have enough money to eat. You might end up skipping some meals because you don't have enough food and you might struggle to buy more. You might find yourself unable to eat a nutritious meal because you can't afford it. You might be going hungry because of a lack of money, or it might look like running out of meal swipes and not having enough money to supplement. So considering college students and how food insecurity might actually impact their performance in school. So it's been shown that students that experience food insecurity are more likely to skip class. They tend to have lower GPAs. They have higher rates of stop out or dropout. And they might forego other important purchases. So things like textbooks, utilities for where they live, other things that they might need for classes, just so that they're able to access food. And just to kind of bring it back to a public health viewpoint, so we're kind of looking at college students now, but there are long-term health impacts of food insecurity. So I really like this framework that Seligman and Schillinger have come up with, and it's called the cycle of food insecurity and chronic disease. So you can kind of follow this from like the top all the way clockwise around. So when somebody is facing food insecurity, they might have some different ways to cope with that. So again, their dietary quality might go down. They might be eating more at fast food restaurants because that's what's available to them. They might be eating things of lower nutritional quality because they're more affordable. So again, those are those eating behaviors that could lead to different chronic diseases. So we know that there are several diet-related chronic diseases. So things like type 2 diabetes, coronary heart disease. They might develop some of these things as a result of their diet. And then because of them developing these chronic diseases, their healthcare prices are going to go up, and then they might also have a lower employability due to that. So then again, they're making less money. We move up to like spending trade-offs. So people who might be foregoing purchasing insulin because they don't have enough money and their household income is lower. So again, it's just kind of this vicious cycle that people can get into. So if we can kind of address food insecurity as public health practitioners, we can have a really large impact on the health of individuals and just their quality of life in general. All right, so I'm going to pass it over to Kara now, and she's going to kind of talk about what we're doing at ODU to address food insecurity on campus.
Thank you, Erica. That was awesome. So hi, everybody. I'm Kayla Boone, and I am the Assistant Director for Service Learning here at ODU. Service Learning is an office located in Leadership and Learning. So you may have heard of that office. We are part of that team. We're located in the Student Success Center, and we do a lot of different things on campus. One of those that we are in charge of is the Monarch Pantry. So don't feel bad if you don't know about it. I feel like some people may have heard about it. They don't know where it is. They don't really know what it is. And this is just one of the things that ODU does to kind of combat food insecurity, like Erica was mentioning, because we know that our students need some assistance. So we have a few different things that we do. One, which I mentioned that our office is in charge of, is the Monarch Pantry. So this is located in Webb Center. I was actually just there this morning. We are open on Tuesdays and Fridays, and we it's basically a food pantry that you would picture maybe in your head if you've ever seen one or seen pictures of one. It has canned goods, it has toiletry items, but then what you might not be picturing is that we also have fresh vegetables, fresh fruit. Panera donates to us, so we get bagels, pastries, things like that. Aramark, which is the campus food dining provider, right? They donate to us, and they're amazing. They give us frozen fish, frozen chicken. So we have all kinds of food, and like I said, toiletries as well, and it's totally free. It's all donated, and it's nothing from like student fees or anything like that. And you can come as a student. You just have to have a student ID. Come and you can shop once a week. We have reusable bags, so you can get a bag, fill it up, and then come back the next week and do it again. And there's no questions asked. So that's one thing that I definitely want to make sure that we're clear on. A lot of students get nervous to come, or they'll say like, oh, you know, I think someone might need this more than me, or maybe they're going to ask me questions about like my income or something like that. It is not a need-based pantry. So some food pantries, you do have to show proof of income or something like that. We are available for students. We're here. If you are an ODU student and you are in classes, then you're able to visit the pantry. So this is actually a picture of our pantry here. You can see some of the fresh produce there. And we have a refrigerator that we do keep things cold and kind of have them last a little longer. And that was from this summer. We were stocking the pantry this summer. So the Monarch Pantry is one option that we have. But we also have, I'm going to actually, can I go back, Erica?
Yeah, I can go back. I realized I was like, oh,
you're okay. I just wanted to talk about some of the other ones too, because there's a lot that we do on ODU's campus. The pantry is a really big one because that's truly is free food, right? And we're giving out food and support, and we're there 2 days a week. If you ever want to do a food drive to benefit the pantry, or if you want to talk to me more about it or Erica, you can email us. It's pantry@odu.edu. We're also on Instagram @feedodu. So you can go ahead and check us out. There's also a snack pantry, which is not run by us, but we do work together sometimes. That is run by the College of Business, and it's in Concert Hall. They have kind of like grab and go items, truly like granola bars, like truly snack items over there. And that's just like if you're on the go in between class, can't make it over to the bigger pantry, or maybe it's a day we're not open and you just need something quick. They have some snacks there. And then we also work with the Dean of Students office to do emergency meal swipes. So sometimes students, like Erica said, your meal plans run out, maybe your Monarch Plus runs out, you don't have enough to get you like to the next paycheck kind of a thing, and you really need some meal swipes. If something is going on, SOS, which is the Student Outreach and Support Office, does have the ability to provide emergency meal swipes, which is awesome. And then we also do something, which if you don't know about this, I want everybody to sign up because it's so cool. It's called Mobile Food Connect. Basically, it's a push notification. So we're all familiar with notifications on your phone, right? This is a notification that our office sends out. We actually sent one out this morning, and it pops up on your phone. Like you get a notification and it'll say free food, and it'll tell you what kind of food, and it'll tell you where on campus. So if there's ever an event and they've spent, this fancy day having a dinner and all this stuff, and they have leftover food, rather than them throwing it away and having all that food waste, we send a push notification out, and ODU students who have signed up for it get that notification. They go to the event, we have to-go containers, and they just take food with them. So we do that all the time. We did a push notification this morning. In the pantry, we have bagged meals today. They're kind of, while supplies last, we wanted to let everyone know that we have them and just invite students across campus to come get these bagged meals. So that's something really, really awesome that I think our school does that is unique. And so you can just sign up for it. It's a phone app. You just go into like your App Store or Google Play and download Mobile Food Connect, and then sign in with your ODU information, and you'll get some push notifications when there's free food on campus. So that's pretty cool. Now you just saw, oh, look, someone uses food. Did you get the push this morning? Go get a bagged meal because we have them. So with the pantry, I want to talk a little bit about how that works. It is in Web Center, like I mentioned. It's not super out in the open, so I want to explain where it is. If you are looking at Starbucks, it's to the right. There is a stairwell to the right of Starbucks, so you would go in that hallway and that stairwell. We're at the very end of the hallway. Okay, so if you kind of can picture where that is, it's not a huge space, so we do limit how many people can shop at one time, but you can just kind of hang out in the hallway and then come in and shop. We have, like I mentioned before, all of those fresh fruits, vegetables. We have canned goods, toiletries, pasta. We have bulk dry good like rice, beans, cereal, things like that. And we do take requests. So if there's something that you're looking for that is not there, we can do our best to try to get that donated for you. We are open 2 days a week, Tuesdays and Fridays from 11 a.m. to 3 p.m. And like I said, you just have to provide your ODU ID card to access it. And you can do pre-orders as well. I will throw that out there. That is on the slide here at the bottom. So if you're someone who's like, I'm not really like comfortable doing this, I just want to go in and like pick up a bag that I've already placed an order for, I don't actually want to go in and look around, that's an option too. You can do that on our website. So one thing I would also like to mention, Erica, thank you so much for pulling these numbers. The pantry has been increasing in usage. So we are fairly new still. We started in 2020, so we're not very old, but we are growing rapidly. So if you are interested in food insecurity and you want to help out, you want to coordinate some like food drives, or maybe you want to volunteer, we would love that because our numbers are just wild. So if you take a look at the numbers on the right here, Erica pulled some data, which is awesome. We do periodically weigh food that students are taking just to kind of get an estimate of how much we're distributing. So in spring of 2022, so this past spring here, we distributed 9,000 pounds of food. Then in summer, which was this past summer, right? Summer is different than a regular semester, if you think about it. We don't have as many students on campus, like not nearly as many students on campus. It's a different amount of time, right? Where it's not classes, all that kind of stuff. We still distributed more than we did in spring. We distributed 12,000 pounds of food in the summer. And then fall, which is this fall, we're not done yet, but our numbers are already way over what we've done in the past. So every single month, our numbers increase. It's awesome because we want to feed students and we want to be there to help, but it's also one of those things where we're excited to hopefully work with some more partners because we're going to need some additional support if we keep growing. So we want to tell everyone about it, but we're also like, do you guys want to work together? Because we would love to have some more volunteers and some donations because everything is flying off the shelves. So if you are interested, and whether you want to shop, you want to do a donation, we also have an Amazon wish list. So if you are an Amazon person and you're like, oh, I'd love to like add some peanut butter or some toothbrushes to my cart, like those are items we can never keep on the shelves. Like we have a wish list of some of our high need items and it gets shipped directly to the pantry. So there's a link in our Feed ODU bio. This is our Instagram. So if you want to go on our Instagram, you want to make a donation, that's there. Our information is there. Please do share that we exist. A lot of people either one, don't know about us or don't know how to find us or think, like I said, oh, maybe someone else needs it more than me. Everyone is welcome. It's not, no questions asked. We're not going to say like, oh, do you really need to be here? We would never ask you that. Everyone can use some help, right? And like Erica said, 1 in 3 college students does by definition need this resource. So we're never going to turn anyone away as long as you are an ODU student. You're all welcome and we would love to see you. Okay, so please share that we exist and please help us by organizing a drive or coming to volunteer. Oh, look, Amy put a little link in. Thank you, girl. Yeah, we would love to have you guys. So if you ever want to come do a tour or anything like that, we would love to work together. We really appreciate you guys giving us the chance to talk today. Does anyone have any questions about the pantry or food insecurity? We have our contact information up here. I know Erica can also talk about the pantry a lot. If you have any questions, she could probably answer too. She's been doing pantry things for a long time.
Yeah, I think we'll save until we'll let like Kayla go and then we'll do questions all at the end. Okay. But the other thing I want to, just push, if you all aren't following us, like the PHSA, the ODU PHSA on Instagram, we are actually doing a drive for the pantry this month. So this is a good push. If you haven't given anything yet, we additionally have the link to the Amazon pantry wish list in our bio on Instagram. I know a lot of people in both the MPH and the public health program are virtual. So we thought that was kind of the easiest way, but you can always, if you are interested in dropping something off in person, you can always bring stuff by the pantry as well. But yeah, just to push that. And yeah, the one thing I also, to kind of connect to what Kayla's about to talk about, is at the pantry, we do also offer personal hygiene items, which include period items for those who need them. So it's kind of a nice segue, and I'll kind of let Amy kind of do the transition over, but yeah, that's kind of our piece now. And hopefully there'll be some connection between the two talks and we can definitely answer questions once she's able to speak.
Yeah, Kayla, I don't know what necessarily you have on your agenda, but definitely they overlap 100%. We do provide, like Erica said, we provide all kinds of toiletry items, but we do have tampons, pads, different like absorbencies, all that kind of stuff. And it's something that is constantly going quickly off the shelves. And I'm sure you can talk about why they're hard to come by and definitely have some issues there, but we would love to work with all of you. So thank you so much. And I'm excited to be here.
Well, thank you, Kayla. This is Kayla Wall Green. As I stated before, she's from the Old Dominion Center for Women and Gender Equity, sorry. And do you have access to share your screen? Just
I'm gonna try right now.
Okay, because I know occasionally we have some technical difficulties and it's usually on my end, so. So perfect. And so again, she's going to be discussing period equity, how it affects campus as well as in general, and she's going to give us some great resources as well. And any questions we can have, we'll have some time at the end to discuss them. I think you're muted.
Okay. Are you able to hear me now?
Yes.
Okay. Awesome. Okay, so my name is Kayla Wall Green, and I am an intern at the Women and Gender Equity Center. I just started interning this semester, and when I interned, a nonprofit called Free Flow, founded by ODU alumni, reached out to us in the Women's Studies Department. Their whole nonprofit is to provide period products to people who need them, and especially during disasters, people don't think about how that's like a needed necessity. It's often forgotten during like hurricanes and such. And so this campaign that we have at ODU is called Period Supplies Are School Supplies. So I'm just going to talk about period stigma, period poverty, and period equity. So period poverty refers to the social, economic, political, and cultural barriers to menstrual products, education, and sanitation. So we can go over global period poverty a little bit, because when people mention the word period poverty, it often refers to lack of hygiene facilities, which is not something that is really experienced in the US, but I think it's important to go over. So globally, an estimated 500 million people who menstruate lack access to menstrual products and hygiene facilities. So these are, as far as the hygiene facilities, these are places that don't have access to clean water, don't have bathrooms or private bathrooms for different genders. They don't have places for people to dispose their period products. And then as far as lack of access to menstrual products, that's pretty much universal. They have the lack of access to the products due to not being able to afford them. So they may use alternatives. Popular alternatives are using things that are accessible, such as toilet paper tends to be accessible in a lot of countries, such as the US. People have also used socks. They have used rags, which brings up health concerns, because many people have contracted urinary tract infections or different types of infections. They also are more likely to not attend school, or their attendance rate to school to be lower. And they also feel a sense of shame or low self-esteem when they don't have, when they feel like their access to period products is not valued. So these are some countries that have entered the fight to end period poverty. So Scotland in 2020 became the first country to offer free sanitary products at designated public spaces. So community centers, pharmacies. I'm not sure if they have public libraries, but in the US, this would look like having period products offered at all of our libraries and other public spaces. In Kenya is the first country to remove taxes on imports of period products. This is a country where a lot of girls, their attendance tended to be low. So they were trying to address the attendance rates of the girls missing school. In South Africa, they have ended taxes on period products for consumers. And then in Spain, in the city of Seoul, in the country of South Korea, they're implementing policies for menstrual leave to address not only just the poverty and the lack of access to period products, but also the pain that people may feel when they are experiencing their period, and being able to have paid leave for that. So period poverty in the US, there are an estimated of 16.9 million people who menstruate, who are also living in poverty in the United States. 2/3 of the 16.9 million low-income women in the US could not afford menstrual products in the past year, with half of those people needing to choose between menstrual products and food. So often the less expensive product wins, whichever one is less expensive, they choose. Black and brown people are disproportionately affected. So Black and brown people make up a lower percentage of the general population, but they make up a higher percentage of people in poverty. The same thing goes for LGBT people. They make up a small percentage of the general population, but a very large portion of homeless people and people in poverty. I think about the percentage of LGBT people, LGBT youth is they make up 44% of the homeless population, of homeless youth. So again, they tend to use alternatives such as the toilet paper. In the US, toilet paper is pretty accessible. So that is a popular alternative. Another dangerous alternative is wearing the period products for longer than recommended, which can lead to serious infections. It can lead to death, rarely, but it does happen. And it used to happen way more like in the 1960s and 70s. Often schools do offer free period products. I think in Virginia, they're required to, public schools are, K through 12. But students can, because of period stigma and people shaming people who have periods, often they choose not to go to those places to pick up the period products. They're often not in private spaces. They're more in spaces such as like the nurse's office, or they have to go directly to someone and ask. And many children can feel hesitant to do that. As I think Kara was explaining about, even with food, even with receiving free food, people have like a hesitancy, and it's like kind of a barrier when there's like a sense of shame attached to it. So period poverty in school. 1 in 4 students who menstruate struggle to afford period products. These students are more likely to miss school due to not having that necessity. Before COVID, 4 in 5 teens reported missing school or recalling a friend missing school due to not having the needed period product. First-generation college students and students who were born outside of the United States were also more likely to experience poverty. And I know with the Monarch Pantry, that is also tends to be like a similar demographic that needs more support for food or products. College students who experience monthly period poverty are more likely to report depression, which can impact their grades. It can impact their attendance, their mental health. Okay, so school's role in access. So young people who menstruate most of their time, spend most of their time at school. This includes college students. I don't know if I mentioned this before, but 1.8 billion people in the world menstruate at this moment. I know there's 8 billion people in the world recently. So it's a big number, but it is a minority of people, and a lot of those people who are menstruating are children, or they're at a very young age. So they're spending, a lot of children or people in college are spending most of their time in school. And many schools provide free period products in health centers and offices, such as ODU. We have free period products at the Monarch Pantry, at Student Health Services, at the Women and Gender Equity Center, and health promotions. But stigma in education is still a barrier to access. That is one of the major barriers when it comes to period products or period poverty. So some schools in Virginia have tackled this issue. JMU, for example, has period products accessible in all of their bathrooms. So students don't necessarily have to worry about that embarrassment and shame because they can access it privately, and it's just as accessible as toilet paper and the other things that are valued and seen as a necessity. So why is stigma and education a barrier to accessing period products? Like I said before, people are embarrassed to talk about the issue that they face. Oftentimes, young girls or people who have periods, when they're younger, they're told to keep it a secret or to hide it. And then people who don't have periods also feel uncomfortable talking about periods. So when people are experiencing poverty, when they can't afford period products, when they're using toilet paper instead of tampons and pads, they're not telling anyone about it because they're embarrassed. So the issue doesn't have a lot of awareness around it because the people who are experiencing it are afraid to speak up about it. And then the people who don't experience it don't feel like it's their place to speak about it. So I'm just going to show a little bit of facts about stigma and how much it really does impact people's behavior. So one statistic is 42% of women have experienced period shaming. 1 in 5 being made to have these feelings because of comments made by a male friend. 63% of women have canceled plans because they were dealing with period pain. While most say that they gave their real reason as an excuse, 40% admit to having made up a false explanation as to why they couldn't attend the event or plan. So 44% of people surveyed have felt awkward while buying tampons or pads, a necessity, at the store. We don't really see this when people are buying other necessities such as toilet paper or a mask or anything like that at the store. And then 48% of people have felt a sense of embarrassment simply because they were on their period. So there's just a lot of shame attached to the biological function of having a period, talking about periods, and then on top of that, period poverty. It's hard to tackle because people don't want to talk about it, or they just feel a lot of shame towards it. And 73% of people have hid a tampon or pad from view on the way to the bathroom. So that's a very large amount of people, a large amount of students, feeling like they need to hide even when they do have access to the product, such as when it's at the women's center or at the student health center. They may feel embarrassed to come and talk and ask, can I have a tampon? So how is ODU addressing this? So from October 24th to November 28th, we've been holding a period equity drive. So we're asking for tampons, pads, and really anything that's period related. We've even had people gift heating pads, which I thought was really nice. Just very thoughtful. Anything to really do with that experience that someone's going through when they're on their period. And the locations are pretty small, but I can send that paper later. But the locations are the Fraternity and Sorority Life office, the Women and Gender Equity Center, the Women's Studies Department, Student Rec Center, and I think there's one more. Oh, Health Promotions Office. And those are places where you can donate in person. If you're not able to donate in person, then you can scan the QR code or go on the website, and it will give you a link to the Amazon Wishlist, or you can make a donation via PayPal. So on November 3rd, I gave a presentation on period stigma and its impact on period poverty. So I think that's an example of how we can address period poverty is by keep talking about it, because many people face it. 16.9 million people face period poverty. And that's a lot of people, but it can be hard to talk about. So if we just push through that stigma, I think that we could tackle it, because it is not a shameful thing. It is a natural biological function. And we can also advocate for the access to these needed resources. So our goal is to have 500 packing kits or period kits. And I think about 5 tampons and 9 pads in each bag. So that makes 3,000 tampons and 4,500 pads. And right now, I just did a count last night. Right now, we have about 290 tampons and 574 pads. That is not including the monetary donations that we've gotten. I know that we've gotten at least about $200 in monetary donations. So we will be collecting these donations until November 29th. So these are the list of places where you can get resources either at ODU or around ODU. I know I mentioned the Student Health Center and the Women and Gender Equity Center, which are on the side of like Pizza Hut in the Web Center. And then Health Promotions Office and the Monarch Pantry are also on like this, they're near each other and they're near Starbucks. And then there's Eleanor's Bookstore, which is a place that I personally used when I needed it, which I think is on 21st Street or near around there. It's about like a 5-minute bike ride, and they have a period pantry right outside their door. You don't have to ask anyone or anything. You can just take what you need, and you can also donate if you'd like. But yeah, that's all I have. Thank you so much for coming to listen to hear about period equity, period poverty, and period stigma.
Well, thank you for sharing with us. And I definitely linked your link tree in the chat box so everybody has access to if they want to donate or if they need supplies or come to any of the events. Does anybody have any questions for either Kara or Kayla or Erica? And if not, that is okay too. And I have given also the link to the Eleanor's Bookstore in Norfolk. So if you need information on that, it's also in the chat. And again, I want to thank everybody for coming. If you need anything, I will be sending out an email after this with information for both the pantry and the period products drive that is going on, so that if you either need anything or want to donate, you have access to that. I'll be giving all of that information out. And yeah, if there's anything else I can do for you guys, please.
I think somebody asked about a recording. So we have a YouTube channel. So maybe Amy can send that out too when she sends the resources, or we can link to it. Or if you Google ODU PHSA YouTube, I think it should come up.
Let me find that link for you real quick.
Yeah, but that's a good question. And also just to kind of plug our other public health talks, if this is the first one you've been able to attend, we do one every month. And so we recently made our YouTube page where we've been posting all the recordings. So if you kind of want to see some other talks that we had one on monkeypox, and we also had one with Healthy Chesapeake that does a lot of work addressing chronic disease in the Hampton Roads area. Those two will be on there in addition to this talk.
Yes, so our YouTube, this should link you right to it. I have not figured out how to change it so that I can put our name in the link to make it easy. Once I figure that out, I will get on top of that and change it and make it easier for everyone. Oh, and then Ray also has the playlist of public health talks. So thank you, Ray, for that one. And if I do not have your email, so if you are not part of the Public Health Student Association and you would like the email, I'm going to ask you to go ahead and either put it in the chat here, or I will give you my email so that you can email it directly to me. And I can get you on the email list for all of the information today. We only have email addresses for people who are specifically in the PHSA, even though everyone's invited to come to these talks. But yeah, go ahead and email me your email address if you want me to put you on that email list. Katie, I don't think I have your email address. I know you'd mentioned wanting that. Oh, perfect. And Kayla, that's great. Thank you. So again, if we have no questions, I just again want to thank everyone for coming. And again, Kara and Kayla, it's been great. I really appreciate you guys coming to talk with us. Erica, you're forced to be here, but I'm glad you come anyway. And I'm glad you have great information to share with us. So again, thank you for coming. And our next public health talk won't be until February because we're all getting ready for the end of the semester. So thank you.
Thank you.